We always hear that pregnancy is supposed to be 9 months of pure joy and glowing happiness. But what if it's not? What if, right alongside all that excitement, there's this constant, nagging worry? Today, we're going to talk about prenatal anxiety, what it is, why it happens, and most importantly, what you can actually do to feel better. And that's a question that can carry so much guilt, right? You see the happy announcements, you see the perfect baby bump photos, and you can't help but wonder, what is wrong with me? Let me tell you right now, there is absolutely nothing wrong with you. Feeling anxious during one of the biggest life changes imaginable isn't just understandable, it's incredibly common.
So first things first, let's actually put a name to what you might be feeling. Because, just understanding what's going on is always the first step toward getting a handle on it.
So, what are we talking about when we say prenatal anxiety? Well, it's more than just the occasional what-if worry. It's this ongoing anxiety that can really start to interfere with your daily life. But listen, the single most important part of that definition is the end. It is so treatable.
So, just how common are we talking about here? Research shows that anxiety disorders affect somewhere between 11 and 17% of pregnant people. I mean, think about that. If you're feeling this, you are so far from being alone. This is a shared experience for millions. Okay, so that naturally leads to the big question. Why? Why does this even happen? Let's dig into some of the factors that can play a role in anxiety during pregnancy.
At its most basic level, it's a totally natural response to massive change. I mean, your body is flooded with hormones like progesterone and cortisol, which can directly mess with your mood and your stress levels, all while your entire life is basically being rewritten. It's kind of the perfect storm for worry and fear to creep in.
And when we dig a little deeper, researchers have pinpointed some specific things that can make you more vulnerable. Stuff like not having a strong support system, having a history of mental illness, or dealing with high stress or past pregnancy complications. Sometimes just seeing these things listed out can help you connect the dots for yourself.
All right, so how do we treat this? Let's start with a topic that can feel, pretty complex and even a little scary: medication. The most important thing here is to see this as a conversation to have with your doctor, where you weigh all the options together.
Now, this is so important. We have to reframe this decision. It isn't just a simple choice between taking medication and having no risk. The real choice is between the potential risks of medication and the very real risks of untreated anxiety, which can include things like preterm birth and complications during delivery. The key takeaway here is that doing nothing is not the risk-free choice. Now, when medication is the right call, doctors often look at options like SSRIs or SNRIs. So SSRIs, like Zoloft, for example, they basically work by giving you more of that feel-good brain chemical, serotonin, which helps keep your mood and anxiety in check. And the good news is, they're some of the most studied medications for use during pregnancy, so there's a lot of data to go on.
And look, to put your mind at ease a little, here's a direct quote from the CDC. It says that even though some studies might show small links between certain meds and birth defects, the actual, real-world risk is still very low. Hearing that from a source like the CDC can be really reassuring.
Okay, but medication is not the only tool in the toolbox, not by a long shot. There are some other incredibly powerful ways to manage prenatal anxiety, like therapy and simple self-care.
Therapy is, honestly, one of the absolute best things you can do. Cognitive behavioral therapy, or CBT, is especially amazing for anxiety. It's like it gives you the skills to become a detective of your own thoughts. It teaches you how to spot those anxious thought patterns, challenge them, and basically break the cycle that keeps the anxiety going. And, on top of professional help, what you do every single day makes a huge difference. These aren't just fluffy suggestions, they're based on evidence. For instance, getting regular exercise that your doctor says is okay can help balance those mood-stabilizing chemicals in your brain. And even something as simple as scheduling your day can give you back a sense of control when everything feels, totally chaotic.
So when you're in the middle of a high-anxiety moment, you need something you can do right then and there. Here is a super simple grounding technique. Let's just try it together right now. Go ahead and take a slow, deep breath in through your nose. Now hold it for 1, 2, 3. And now just exhale slowly through your mouth. That simple little action helps pull you back to the present moment and tells your nervous system it's okay to calm down.
All right, so we've talked about what this is and some ways to manage it. But how do you know? How do you know when it's really time to pick up the phone and get professional help? Let's look at the signs.
Think of this as your personal checklist. If the anxiety is getting in the way of your day-to-day life, if the worry just feels out of control, or if you're getting physical symptoms like headaches or you just can't sleep, it is absolutely time to talk to a doctor. Please, there is no prize for suffering in silence.
And one last super important point on getting help. You've got to be proactive. If you already have a history of anxiety or depression, experts say you should reach out to your provider early on, even if you're feeling totally fine right now. Trust me, it is so much easier to build a safety net before you feel like you're falling.
So after all of this, what's next? The most important thing is what you decide to do now. So I want you to ask yourself, what is one small, manageable step you can take for your well-being today? Maybe it's just trying that breathing exercise again. Maybe it's calling your doctor's office. Whatever that one small thing is, just know that taking that first step, well, that's the most powerful move you can make.